Health Alert at 7:24. LASIK's one of the most well-known corrective eye surgeries, but for some patients, there can be severe pain in the wake of that surgery.
So doctors are now warning how serious this condition can become. So earlier this year, the husband of a Detroit meteorologist who killed herself linked her suicide to the procedure. The dangers are now the focus of a new Wall Street Journal report.
News for Jack's reporter Ashley Harding joins us live this morning. Ashley, you talked to a local ophthalmologist who took part in that report, and he wants to make it clear this condition's rare.
Yes, Bruce and Jen, good morning to you both. He says it is rare, and in his clinical experience, he says this happens after the nerves are damaged during the surgery, and he says this can make the eyes hypersensitive to something even as simple as a gust of wind, and he wants to reiterate, yes, it is rare, but it does happen, and people need to be aware of it.
So in a typical LASIK procedure, you make a cut in the cornea, right? And then you lift this flap up.
Dr. Gulani can break down everything there is to know about LASIK eye surgery.
While cutting this cornea is when you end up damaging the nerves.
What might be harder to understand is the debilitating pain that can sometimes come post-surgery. It's the reason why patients from all over the world end up in Dr. Gulani's exam room.
When these patients fly here, you can imagine the amount of time and money they're spending just in flying to me. It tells you already the level of pain that they're going through.
Dr. Gulani has divided these patients into two categories, transient and chronic. He says in a transient case, the pain can become well controlled in about 3 months through treatment. The chronic case is different. He says this is where the pain is so severe it can lead to depression and in some cases, suicide.
LASIK is an elective surgery, so you did not begin with the disease. You were normal as far as you are concerned. And to come back with a disease, it becomes unacceptable.
Dr. Gulani says prevention begins with awareness for both patients and doctors. He also believes a newer technique, one that doesn't involve cutting or blades, will help with prevention. That takes us back to the screen.
You're using the laser in a very superficial but smooth surface mode without cutting. So you're not cutting the nerves.
Dr. Gulani advises patients work closely with their doctor and be their own advocate.
Find out why that procedure that has been picked is the best for you. Is it because the surgeon only knows those 2-3 procedures, or is that the right fit for you?
And on that note, Dr. Gulani says there are 23 different laser vision surgeries. He says LASIK is just one of them. That's why he says patients need to ask questions of their doctor and be part of the process in determining which procedure is best for them. Reporting live this morning, Ashley Harding, Channel 4, the local station.